Hi, this is Kimberly. I'm here at the ePatient Connections Conference in Philadelphia. I'm here with Mark. Mark, can you explain what you do and what your company does?
Sure, I'm Mark Langsfeld, the founder and CEO of ListenLogic. We are a social market research and analytics company focusing on pharma and help companies understand what people are saying about them and their disease states and drugs on the web.
Okay. So you presented earlier this morning, and I was wondering if you can reiterate some of your points from your presentation.
Sure. I think the main point that we're seeing in pharma today is that there's a big elephant in the room, and that's that patients are going on the web, they're reading information, they're posting information about health, the lifestyle, different alternatives to medicines, the treatments that are developing in the marketplace, and really understanding all of what's being said. And with this big elephant in the room, really pinpointing down what patients are saying to other patients, what patients are saying about what their doctors said on the web, and really isolating that down, doing research to understand what the client, or in this case the company, pharmaceutical company or healthcare company, can learn about how to manage their drug or their product.
All right. So one of the themes that you touched on is the immediacy of the web. Can you elaborate a little bit more on that?
Yeah, absolutely. One of the case studies we went over this morning was the recent events that happened with Avandia. And Avandia, the type 2 diabetes drug, was recently taken off the market in Europe. And in the U.S. last week, the FDA put on severe restrictions on the drug, so that it's a lot of people on the web are talking about this, needless to say. And what we're seeing on the web are people are saying, well, my doctor said I should stay on the drug, which is fascinating. Almost 3 to 4 times that what patients are recommending to other patients. Patients just want to flee. They want to go on insulin. So they're actually giving up on the whole category of this drug and just switching over to insulin. That's what they want to do. And we help companies understand why they want to switch from this to this and that to that. And so there's a lot to be learned, and being able to track this as it's happening with the immediacy of the web is really paramount for companies, and I think they're getting it now, and there's a lot to learn for their decision making.
So what are you looking forward to moving forward in the ePatient Connections Conference?
Well, I think this conference has certainly grown up. This vertical is definitely getting more mature. They understand how consumers are now moving to the web and to get a whole host of information to make better decisions in their lives. And it's really great to sit down with clients here as well as prospects and other healthcare providers to really understand their needs and what issues they're seeing, what trends they see in the marketplace, as well as what we can do to help them make better decisions.
All right. So thank you so much for speaking with us, Mark. And this is Kimberly from Pixels and Pills signing off from the ePatient Connections Conference in Philadelphia. Thank you.